traditional custodians of the land on which we gather today. We recognize their ongoing connection to the land and value their unique contribution. We pay our respects to Indigenous elders, past, present, and emerging, and extend that respect to any Indigenous participants watching this webinar. Today's topic is digital literacy in culturally and linguistically diverse communities. Digital literacy plays a vital role in ensuring fair access to healthcare services, particularly for CALT communities, where language barriers and limited technology skills can hinder access to essential resources. Empowering these communities with digital skills is key to improving health outcomes and closing these gaps. We are proud to collaborate with the Good Things Foundation, a leading organization committed to digital inclusion. They have helped over 4 million people improve their digital skills, fostering greater access to online opportunities and services. Together, we are working to enhance the digital health literacy and create a more inclusive healthcare system. Before we move forward, I would like to highlight Smart Health Global's mission to provide equitable, accessible, and innovative healthcare solutions, especially in the underserved regions. Our vision is to build a world where healthcare is inclusive and accessible for all, regardless of location or socioeconomic status. This webinar is a reflection of that commitment to bridging healthcare gaps and enhancing digital health literacy. Now, it is my pleasure to introduce our esteemed panel members, each bringing a wealth of knowledge and insight on today's topic. To start off, I would like to introduce Mr. Manoj to say a few words.
Thank you, Akila. Thank you so much for organizing this, facilitating this webinar. My name is Manoj, and I'm CEO and co-founder of Smart Health Global. I'm working since 8 years within this digital health space, and I love to help people with to enhance knowledge in terms of digital health and health awareness. Thank you so much. I'm looking forward to learn and share our thoughts and knowledge what we have gained. And thank you so much to Good Thing Foundation for giving this opportunities and for organizing this webinar. Thank you.
Thank you, Manoj. Dr. Yakindra, would you like to go next?
Hello, everybody. Welcome to this webinar. I'm Ekindra Timensena. By profession, I am a food scientist, and I have been involved with this Smart Health Global since a year, and I am serving the community as a Director of Grant Development and Networking for Smart Health Global. Thank you for Good Things Foundation to support us in getting online and becoming navigating the online space securely. Yeah, we look forward to see all the attendees, your thoughts and the feedback will be helpful. Thank you very much.
Thank you. Uh, Dr. Raju, would you like to?
Thank you. Good morning, everyone. It's a great opportunity to be here sharing this online forum for a very important topic we're dealing with global smart health. And also, as Yakinda mentioned, thanks to the Good Things Foundation for providing the resources to for this project. I'm Dr. Raju Dikari. I work at CSIRO. I'm heavily involved in community work, and with Smart Health Global, I'm the research director. And it's been a great privilege and honor and pleasure to be part of this great initiative. And we hope that we will be able to empower our CAL community in a big way at the end of the project. And look forward to hearing today's meaningful discussion and interaction with you all. Thank you.
Thank
Thank you. And so,
I'm Komandaka from
Nepal.
Switzerland campus, Nepal.
Thank you.
Thank you.
thank you, everyone. So now I would like to invite Mr. Vishwas to talk on digital security.
We have Pratima. If you can.
Pratima, would you like to introduce yourself?
Hello and namaste everyone. This is Pratima, and I'm currently studying digital health and also working as a project assistant in Smart Health Global. Glad to be here. Thank you.
Thank you.
Thank you, Fatima. And yes, thank you all for your valuable contributions. I would like to now invite Vishwas, who will be discussing on digital security, a crucial aspect of digital literacy that ensures the safety and privacy of online interactions. Over to you, Vishwas.
Great. Thank you, Akila. So before we begin, just let me know if you can hear me all clear.
Yeah, all good.
Okay, great. I'll be trying to share my screen and let's see if it works smoothly. So can you see my screen now? Hello?
Yes, we are able to see your screen.
Perfect. So I'll be just going to my presentation for today. Uh, just let me know like if the slides get stuck or if you can't hear me at any point of time. So without taking much time, I'll dive straight into today's presentation. So let me start by thanking Good Things Foundation for this opportunity given to Smart Health Global to extend our skills and knowledge in this very useful and very, very important aspect of online security, where we'll talk about how to keep one safe online for their online activities. And thank you to Akila and the team who is organizing and coordinating all the events today. So starting about me, I'm Biswas Bhatta. My background, educational background, lies in a master's in innovation and e-governance, and I have a bachelor's in engineering in computer engineering. Currently, I'm working as a CTO for Smart Health Global, and I also work as a digital health mentor for the Respire project at University of Edinburgh. So before beginning the main content of the presentation, uh, let's ask why digital safety, right? So we know that everything around us is becoming more and more digital. Everything that we do, everything that we use, even our cars are becoming more and more digital. We all use smartphones. We entertain ourselves using digital devices. So every aspects of our life is becoming more and more digital. And as it becomes so, the risks and dangers associated with it also increases every day. And you can see the screenshots of few headlines regarding digital scams that I gathered. And if you notice the date, it's just from past few months, right? So, and it's just from Australia only. So I just took the screenshot of just four headlines, but from the headline itself, you can see like these are this kind of scams and this kind of digital crimes are very, very common all over the world. So it's very, very imperative and also very essential for us to be aware about like what kind of dangers are out there and how to keep ourselves safe from there. So I think we know like why the digital safety is required. So let's move on to how to keep one safe in this digital world. So talking about security, whenever we talk about security in any kind of system, it doesn't need to be a digital system. It can be a physical system. It can be our home. It can be our offices. We have security systems in our offices, in our homes. We have security system in our cars, in our devices, right? So one thing common in all kind of security system is the system is only as strong as its weakest link. So I wanted to just make this very, very interactive and see your opinions and get your opinions on like what do you think is the weakest link in any kind of system, or if you want to be very specific, let's say what are your opinion on what is the weakest link in a digital system. So if you can see the QR code on my screen, you can just scan it and it will lead you to a quiz page where you can submit your answers. So if you're interested, you can please do that. Or I'll also share the link in our chat as well. Just let me know if you can access, if you can't access the link. I'll just give you maybe, let's say, a minute for everyone to just open up the link and submit your answers. Great. I think we have 2 submissions so far. If anyone's having any issues opening the link, just let me know, okay? That's a great answer. Payment link, digital skills. Again, really good answer. Great. User awareness. A very good point again. Yeah, 15 more seconds. And I'll just close this. Okay, since we're very short in time, I'll just end this right here. So we got 6 responses, and the answers we got were user awareness, digital skills, payment link, user, data sharing, and privacy. Again, everything, all the answers that came in, like really, really good answers. Again, everything that you mentioned is really, really important. Yes, the users need to be aware, the users need to have good digital skills. Payment link, yeah, most of the scams that we know and hear about are always related to some kind of payment. So it's all about phishing. So this is also a really good answer. And data sharing and privacy, we need to be very, very careful about where we are sharing our data with and how we are keeping ourselves as well as our data private and users. So yeah, because we don't have a lot of time today, so I'm going to end it right here. And thank you for your participation. And let's jump back into our presentation again. So again, thank you for your answers. So in the digital system, I'm happy that I got the answer I was looking for. Although, like, I won't say like everyone is like not wrong there. That's a really, really good point. But in a digital system, the weakest link is always you, right? The user. So, and you must have heard about these incidents like from around your workspace, from the news, right? So it's a very common phenomenon called social engineering. So most of the time when you hear about some organization getting hacked or some people getting scammed, it's not very technical in nature. It's just social engineering. What they do is they contact you in personally. They try to use the information they can find about you and use that information against you. Sometimes it's as easy as calling the organizer and telling them like they are from some kind of security organization and asking for your password and using that password to hack your account. So it's always the user that's always the weakest point in the digital system. It's always a human. So we being the user, we need to be very, very careful about all these things because we are always the weakest link in the system. A digital system can be made very, very secure from the technical side, but if the user itself is not very aware, is not very skilled, and do not know about best practices and good practices, then he or she can be the source of the scam or the hack of the system. So, saying all these, how can one be secure online? Let's jump into it. So, I'll just talk about like few common mistakes and scams that happen all around the world, and how we can be vigilant, how we can employ best practices, good habits, how we can um, instead good habits for ourselves to be safe from these kind of scams and mistakes. So let's start from the most common mistakes that a user does in his daily online activity, and that is related to bad passwords. So one of the most common mistakes that we do is using the same password everywhere. Like we have one password and we use that password every kind of application, every kind of email account, every kind of social account. So what happens is like if one of these applications or social media or website gets hacked, the hacker can easily then get access to everything else. Like they can access your emails, they can access your bank accounts because you are using the same password everywhere. So that's one of the most unsafe practice that you can do, using the same password everywhere. And another one is sharing password with others. It's very common for us to like share our password with our friends, with our spouses or partners, even with our colleagues. And it might not be your fault. It might not be directly the fault of the person that you share the password with, but they or you might like somewhat unknowingly leak that password, and some malicious person can then you take advantage of that and then hack your account or your bank account, or make transfers from your account. So that kind of thing can happen. And another one, also this is something I've seen a lot happening, because people find it very difficult to remember their password. So what they'll do is they'll write it down in some kind of paper or a post-it note, and then let that paste that post-it note in a very common place where everyone can see it, right? So I've seen it, people writing the password in a post-it note and then like stick it in the computer monitor that they use. And this is happening in a big organization where um, everyone can see and access the password easily. And another common bad password habit is not using two-factor authentication. So everyone might not be familiar with what two-factor authentication is. So two-factor authentication, and there's one more step after two-factor. It's called multi-factor authentication. So there can be 3 or 4 factor authentication itself. So when we use password, it's just one method of authentication, right? So it's a very common practice nowadays with most of the online services where you'll have to use another kind of authentication beside the password itself. It can be email link, it can be short code sent via SMS, or it can be code that is generated by some kind of authentication apps. So it's always a safer habit to use some kind of two-factor or a multi-factor authentication. And one of the, again, the most common bad password habit is using a weak password. What we do is we find remembering password very, very hard. And because we have multiple passwords, we have to use passwords in like multitude of services, and that the number of services can easily go into like a lot of It can go into hundreds of services. So what we do is we tend to keep it simple and use very easy passwords like 123456 or password itself, or use the name of our spouses or our children or our partner, like very easy things to remember. But what it invariably does is that it makes it easier for any malicious person to guess it and hack our accounts, right? So talking about all these bad password habits, what can we do to make ourselves safe from these? So good password habits, it starts with using a password manager. So always, most of the bad password habits stem from one thing, and that is related to how hard it is to remember our passwords for everything, right? So it may be easy to remember for one or two or three services, but like it's very very hard. It's obvious that it's going to be very hard for remember it for hundreds of services. So that's why we tend to like do all the bad practices that I discussed about, using the same passwords everywhere, writing down the password and like sticking it somewhere where everyone can see, or using very very simple passwords. So everything stems from the difficulty of remembering passwords. So how can we solve it? It's very easy. We can use some kind of password manager. Password manager are applications or services where you can like save your passwords for different kind of services and easily access it whenever you require. It can be a browser plugin, it can be an app that you can install in your laptops or desktops, or you can install it in your phone itself. And one password manager that I will recommend personally is Bitwarden. It's a free and open source, and it's a highly regarded and highly reviewed password manager, and it's very very it's completely free to use for personal purposes. So if you want to check out, if you want to get started, Bitwarden might be a good one to start with. And another good practice is never share your password. And a code that we frequently use in cybersecurity is don't even share your password, even with your partners, right? So it's not like trying to put fault in your partner, right? We are not trying to blame your partner. Even though they don't have any ill intention, they might, leak the password unknowingly. So that's why we say like don't share your password anyone in any kind of scenarios. And the third one is enable two-factor authentication. I already talked about what two-factor authentication is. So it's very easy to enable in most of your services. And a good thing is that like most of the online services are now making it compulsory to use two-factor authentication. So whenever you see option, or whenever they tell you to enable two-factor or multi-factor authentication, please, please, please do it. And then we come to emails. So another very common medium of online scams, phishing attacks, identity thefts is emails. And th- and again, it comes to the user itself, right? It plays on our vulnerability, it plays on our bad habits. And most of the scams are again very very common and very very generalized, like and you'll like when I talk about it further, you'll find it like how funny everything is whenever we talk about these email scams. So when coming to email scams, you need to be remembering that no, you didn't win the lottery, right? It's a very common email scam that happens. You get an email saying that you won the lottery, maybe something in the likes of $10,000 something, and then there'll be a link where they'll tell you to go to claim the lottery, and there'll be some kind of malicious code, or there'll be a number where they'll contact you, and then they'll tell you to pay the taxes first, and on and on. So it's a very simple thing. Remember that you didn't win the lottery. You never applied for it. You never played, or you never bought the tickets. So you there's no chance that you won any kind of lottery. So yeah. Another one is there are no Nigerian princes. Nigeria itself is a presidential republic, and all the kings and kingdoms have already been abolished. So again, technically there are no Nigerian prince, and practically again there are no Nigerian prince out there who are trying to share the wealth with you. And the third point is nobody are out there who wants to share their money or business with you. Again, these are again a very common type of emails that you get, where they say, okay, I have a business that I want to expand in your country or in your territory, and I'm looking for a partner. Or maybe like, I have this kind of money I inherited from my great uncle who died suddenly, and I want to share, or I want to do some kind of charity. So again, remember, nobody is there sharing the money or their business with you for free, right? So it's very easy to like, it plays on our insecurity, it plays on our desire to get rich quickly, and then this is how they scam you. So if you remember all these 3 points, it's a good start. So what are the good practices? Never click on suspicious links in the email. So always be careful about like who the sender is. Even if the sender is a known person, if you find the links that they have sent out on the email very, very suspicious, then don't click the link at all. It can lead you to some website where they'll download some kind of malicious code, and that will hack, that will like steal your secrets, your passwords, your um, um, private data, things like that. So never click on any kind of suspicious links that you get in the email. And another kind of scam that happens is through the attachments that get sent to the email. So again, first, be always careful about who the sender is. If you don't know the sender, then don't click on anything. And even if you know the sender, and if you find the attachments very suspicious, right? So the email might be about something else, and there might be no reason to have any kind of attachment for that email, right? So if you find something like that, then don't download the attachment at all. And always check the email of the sender, right? So the name might be always claiming to be someone else. The name itself, the sender can be claiming to be someone you know, your friend, your partner, your colleague, or like some kind of authority, like from the police department or from the tax department or something like that, or from one of the social media or some kind of online services or app that you use, right? One of the common email that you get will be someone clicking from Facebook telling you that your account has been hacked and click the link to like save your account, something like that. But what you can do is just check the email, not the name, but the email of the sender, and it will be always some kind of very suspicious looking, or it doesn't match the sender that he or she claims to be. An example will be like, so if someone says he or she is from Facebook and contacting you about your account, but if you check the account itself, it will be something like Facebook ads, something random, or something numerical, and .com or even .it, .io, or something like that. Very, very strange email IDs. So if you see something like that, be 100% sure that it's a spam email or it's a scam email, and don't open it or don't respond to it. And if you get any kind of email asking for some kind of information, saying, okay, we are from your healthcare provider and we need your, like, let's say, password and some kind of ID, your insurance ID or something like that, then never send it out. Because whenever any kind of genuine authority figure or authorized organization wants some kind of your private data, they will never contact you through an email. And even if they do, they will always provide some kind of way to verify that they are the real person that they are claiming to be. So if you get some kind of email asking for personal details, never reply them with those kind of details. First, always verify who the sender is. If they are claiming to be someone, you can contact the person or the authority or the organization through another email, or like through a message, through phone calls. Verify it, and then only if the verification, you verified the person, then only send out the information they are asking for. And then we'll come to social media. Now, we've talked about emails. Now, after emails, another common way that people get hacked or scammed is through social media. And one common good practice is not to share your personal details like ID cards, credit card numbers, phone numbers, etc. In social media. So again, this is a very common and thing that happens very very regularly. Like people post a photo of their credit cards, they post photos of their flight tickets, they post photos of their insurance claims. So any kind of like identifiable and secret data in them, never post anything regarding them. Another one is not to share too much about your personal lives and activities. So I talked about social engineering. Social engineering is about using all the information about you against you. So they'll try to like claim to be your relative or your friend, and then use the information that you like publicly share in your social media, and then use that information to like claim who they are. So it's very easy. It makes the scammers life very easy if you are sharing a lot of about your personal lives in social media. And also about activities, again, it's a very common thing to hear about, like people posting about their vacation plans, right? You'll write, okay, going to, let's say, Bali for a week or something like that, and then if you post it publicly, people see it and they go and rob your house during that period. Again, it's a very common thing, and it's very very easily avoidable. So do not share a lot about activities as well. And then enabling two-factor authentication, we've already discussed about this. And again, like it happens with emails, we get a lot of suspicious links that are sent through us through various social media and messaging apps. And also like they are also, if some contact in your friend list gets hacked, then a very common thing the hackers do is they sort of share like these malicious links in their post, and also send everyone in their contact list these malicious links. So if you find something suspicious, again, never ever click those links or download those attachments, or never share the information they are asking for. Always verify it, and if you find something suspicious, never follow through it. And let's come to another common thing that we employ in our daily lives, and those are mobile apps. Mobile apps are very common in our daily life. We use it for various kind of purposes, and again, that makes it vulnerable to different kind of attacks and scams. So one very very common thing that you can do, and that safeguards you from scams through mobile apps, is never to install any random applications. So you may be like getting different kind of advertisements, or some people will send you links, affiliate links about like these new apps or these new games. There might be, someone might send you a link saying, oh, okay, if you install this app, and then okay, send it out to your 5 friends, then you'll get, let's say, $20 in your account. So they might entice you, they might like try to get you to install these applications, and almost always there will be some kind of malicious intent related with this kind of applications. So never ever install these kind of random applications. And another type of application that people are like fooled into or coerced into installing are applications related to making your mobile phone faster, or like which will make your battery long laster, or which will clean up your application, save spaces. We get all these kind of applications all like everywhere. You see ads, you see your friends recommending it. So almost always they are malicious apps, right? So never ever install them. Our operating systems, both on the Android side and the Apple side, are again very very capable and very very updated enough to do all these kind of system related tasks, such as memory management, battery management, quite well themselves. So you don't need to install any kind of third party apps to do those kind of system tasks. So never ever install those kind of apps. And if you are like going to going to install any kind of app, always see the ratings and the user reviews given by them in the App Store. It can be on the Play Store for the Androids, and it can be the App Store for the iOS devices. And you can go a step further and see about what people are talking about it through Google. You can just write the application name and just ask a question: is it safe to use this application, or like what kind of complaints people are having about those applications? And then only if you are satisfied, then only install the app. And then comes about permissions. So nowadays, iOS as well as Android requires the user to provide permissions to the app to use all kind of sensors and access all kind of data in your application. So until and unless you give these permissions to the app specifically, these apps cannot access those sensors or your files by themselves. So whenever you are giving out permissions for any kind of apps, be very, very careful, be very, very vigilant. For example, if it's an app about SMS, and if it's asking you about accessing your camera or your microphone, then that doesn't make sense, right? Why would a SMS app require the access to your phone camera or your phone microphone? So that itself is a very sort of a red flag. So always be careful about what kind of permission the app is asking for, what kind of access the app is getting, and then manage it accordingly. And another safe practice to do is always keep your device updated. And um, this is related to both the operating system as well as the apps themselves. So operating system, it's very, very important to keep your operating system up to date. There might be some security fixes. There might be newer user features making the operating system safer to use. So always keep your operating system updated. Although there are some downsides to keeping like installing the newer versions, but like it's always a good practice. The trade-offs are always on the side of being safer. So always keep your operating system updated, and also keep your applications also updated. So there might be some bug fixes, there might be some security fixes related to the applications themselves. So it's a good practice to periodically update your applications installed on your phones as well. And again, I've already talked about this, and I can't stress this enough. Never share your the unlock patterns or unlock password of your device with anyone, not even your partner. And beside talking about the emails, social media, and your mobile phones and applications, so here are some general good practices that's related to any kind of activity that you do online. So always be vigilant if your webcam or camera is on. So it's very, very easy for a hacker, for a competent hacker to just get access to your webcam and your microphone on your devices, be it your laptop, be it your phone, or be it your desktop devices, right? So one good thing with the modern devices is there's always an indicator light which tells you if your microphone or your webcam is being used. So if you notice the light like turning on suddenly, and if you are not using some applications, or if you are not using the device specifically, then like just cover up your webcam, or like be careful that your device might be hacked, and then like proceed with other steps how to mitigate it. And one easy way to solve this issue is using a webcam cover. So you can see the image attached in the slide. So it's a very easy to buy on online shops, or even in like physical shops. If you go and ask for webcam cover, it's available for your laptops as well as for your phones. And if you're using a specific like separate third-party webcams, most of the webcams nowadays come with their inbuilt webcam covers. So always keep your webcam, if you're using a webcam cover, always keep your webcam cover closed and open it only when you are like using the webcam. So it's a very easy and simple way to safeguard yourself from this kind of scams. And whenever you are using a public Wi-Fi, so it's a very common thing to use Wi-Fi when you are at a restaurant, at a coffee shop, or where if you are working in a university, so you are using the university's public Wi-Fi. So there are like a lot of attacks that can happen. A hacker can impersonate themselves as being the Wi-Fi provider, and then steal all the information that you are sending out through the public Wi-Fi. So whenever you are using a public Wi-Fi, try to make sure that you are not going on to sensitive applications or websites, like your banking websites, your healthcare related applications or healthcare related services, your email applications. It might be something related to like online shopping. Like when you are doing online shopping, you are entering your banking details again there. So yeah, a good practice will be to not use this kind of services or application as much as possible. And if you have to use it, you can use a VPN service. And I'll come to VPN service on the next point. So a common recommendation is not to use any kind of random or a popular VPN service, right? So it's a very common thing. You might have noticed it in a lot of YouTube videos or in like online blogs and online articles. You'll see a recommendation for VPN services. Um, and these are like paid ads to those online creators who then like just push out the recommendation for VPN and because they are getting paid, they don't they don't go through like how safe they are, or like if they even provide all the security they claim that they are providing. So one common practice is to not use this popular VPN that you are like seeing the ads for everywhere, and never ever install any random VPN that you get you get the ad for, or you get the recommendations through any media. So there are like very few university well-reviewed and regarded VPNs, and one of the VPNs that I personally use and suggest everyone is called Molvad. It's very very cheap. It's just around $5 per month, and you can share it with five other users. So if you're sharing with your friends, so it comes down to just $1 per user per month. So it's very very cheap, and it's one of the most trusted VPNs all around the world, even by like technical people. So if you are like looking to use a good VPN, I'll suggest to check out Molvad. And then the next point, you always use secure and up-to-date browsers. So don't use any random browsers. And even for the browsers that you are using, make sure that you are using up-to-date browsers. So there might be some kind of security breaches or some kind of bugs or issues, and they are always like regularly updating the browsers and the safety features. They are introducing new features that helps keep you safe. So always keep your browsers updated. Again, personally, I would recommend using something like Firefox or Chromium or Chrome if you want. These are very popular as well as well regarded. But even if you are using other browsers, make sure that you keep them up to date, and never ignore any warning the browser skips you out, right? So you must have noticed whenever you like, if when you went to some kind of site and the browser still gives out a warning saying, okay, this website looks unsafe, and that's why it won't open the site. So if you encounter something like that, then the safest thing to do is just close the website. The browsers are very very good right now to detect some kind of malicious activities or detect malicious code in these kind of websites, and then warn you about. So never ignore those kind of warnings. But another part of this is like there are some websites where like they imitate these kind of warnings and then trick you into performing some actions through which they can scam you. So again, be careful about those as well. Make sure that the warning that you are seeing is generated by the browser and not the third party sites or something like that. And one of the best thing that I can suggest for your online browsing habit is using ad blockers. So there are twofold advantages that you get by using ad blockers. So one is that you will see less ads. So it's very common to see a lot of ads in almost every website we visit nowadays, right? So, and these are very annoying, and another, it makes the web page load slower because they have to load all these ads from different sources. So ad blockers, first thing they do is they block these ads and they don't show up in your websites. So it makes the website load faster and it makes your browsing experience less annoying. And another thing is like these ads can be a source of scam itself. It can lead you to malicious websites or some websites where they can where they ask you, where they trick you to give out personal details or like private data or something like that. So it also blocks you from that. So it's if there's one thing that I would like you to do right away is using ad blockers in your phones. Sorry, in your browsers, and there are ad blockers for the phones as well. So you can go a step further and use ad blockers for the phones as well. And the one that I personally recommend, and I think it's the most popular and also the most well regarded by the tech community, is uBlock Origin. So you can just Google about it. There are um, I think there are plugins for almost all major browsers. So you can just install the plugin and it will get to work. And finally, so I talked about like very specific things. I talked about emails, I talked about passwords, I talked about mobile applications, I talked about social media. But overall, there are like few things that if you are careful about, then it always helps to keep yourself safe. So one is, again, I've repeated it a lot of time. Again, I think it's something everyone needs to keep repeating it. Is that never share any kind of personal info with random people. So again, when I say random people, it might be someone trying to impersonate someone, like you'll get an email suddenly from your colleagues saying, okay, they are stuck in some random places without their credit card or without any kind of mobile phones or devices, and they need help from you. So they want you to transfer, let's say, $1,000 so they can buy a phone and then contact the authorized person or something like that. So it almost never happens in real life, right? So always, and if you get that kind of email or message, always verify with the person or the relatives of the person, or if it's a colleague, verify with your like colleagues at the office or the admins at the office, and then only proceed with your actions. But almost always never give any kind of personal info related to anything. It can be the info regarding your banking, info regarding your medical records, info regarding your educational history or your professional history. It can be about yourself. So never ever share any kind of personal info online with anyone, even like some kind of acquaintance, unless it's absolutely required. Unless you have verified that it's absolutely required, then only share it. Otherwise, don't. Another one is don't panic if someone tries to intimidate you, right? So one of the very common tactics in social media, social engineering, is to play on your fear. So they'll claim to be from some kind of authority figure, or like they'll try to act like you are in some kind of danger, or you're in some kind of peril, and then instill some kind of fear into you and then use that fear against you. So if you get that kind of it's a very common instance to get a phone call. You've heard these stories from your friends, you've read about it, right? You'll get a phone call from someone claiming from, let's say, a police department or a tax department or social security or immigration or something like that. And because we are talking about cult communities, so it's a very common occurrence with the cult communities, where they'll be claiming they are from, let's say, immigration department or social security, and say you've done something wrong and you'll be charged, or you'll be, detained or something like that. So if something like that happens, the first thing to do is not to panic, right? So even if something like that happens in real life, there will be some kind of ways to verify it. If someone is contacting you from the police department, they'll tell you about like who they are. They'll tell you about their identification number, who they can talk to, and you can call the police department yourself, your local police department, and verify if the information that was given to you is true or not. So the first thing to remember is never to panic, right? Never to panic. If you sort of panic, then your decision making skills get hampered. You sort of you then start acting irrationally, and that's when they start taking advantage of you. So never ever panic. And the last point is, don't hesitate to ask for help. It's sort of a human nature to not to ask for help most of the times, because it makes you feel like you are inferior. And again, we are talking about cult communities, and it's a common thing that you may like feel intimidated, or you may have a fear of being portrayed as someone with lesser knowledge, or being inept, or being technically a layman. So don't have this kind of inferiority or personal like fear of someone, like you being ridiculed by someone, or you're being looked down upon by someone, and not asking for help for that reason. If something happens that you don't have the expertise about, or you don't know how to deal with it, always ask for help. There can be a friend who is like technically really good with computers or like mobile phones. There can be someone in your community that has access to all these authority figures, or there can be some kind of organization that helps you in these kind of scenarios. So always, it can be even your kids, or your partner, or your teacher, or a student. So if there's a situation, if you end up in some kind of situation where you don't know how to proceed, then always ask for help. Nowadays, there are a lot of organizations that are there to help you in this kind of scams and online scams, online malicious activities. Even there are like units within police departments, units within various organization itself, which are out there to help you. If you Google about it, you can easily find information about them. You can talk with your community members within your organization, within your friends, and find out about these organizations and these people that are out there to help you and get the assistance that you require. So again, never ever hesitate to ask for help whenever you need it. And with this, I end my presentation for today. I hope like I was able to give out good information and motivated you to start implementing these bad practices, start using all these tools that I talked about. And I'll be happy to like answer any questions that you have. Thank you.
Thank you, Vishwas. It was very wonderful to see your presentation. It was very insightful, and especially regarding the password manager, all those tips. I'm sure it was very useful for most of us, and you were very specific on your recommendations as well. Thank you for that. I see a hand raise. Samachna, do you have a question? Okay, I don't seem to get a response. So, anyone does have a question to Vishwas?
Yeah, please don't hesitate to ask questions again. Like I
Sorry,
said,
it was just a mistake. I'm sorry.
Oh, that's okay.
Okay.
Yes.
Can you hear me?
Yes.
Yeah, when we're talking about the digital skills and knowledge, I think suddenly we realize very quickly AI has come into very big force, and there's a huge gap understanding the digital in itself, and now AI come into picture. So there's a lot of skepticism about the use and misuse of AI in the digital system. Wondering whether how do you see that AI playing a big role protecting digital digitally us or AI being misused to protect us in a different way.
Yeah, thank you, Dr. Razu, for very, very important questions. And the point about AI is very important in today's context. Um, so with AI becoming like a more, let's say, powerful and with like very, very good with most of the tasks that it does nowadays. So technology always has like two sides. There's also a good part and there's also the bad part, and it's the same with AI as well. And most lots of the point that I talked about in my presentation with AI, it becomes like the magnitude of those things become even higher, right? With AI now, it's very, very easier to impersonate someone. They can easily use the image that you have uploaded in your social media or even in your official profile. You can use just one photo and then create a whole different profile using AI. They can take one video of yours and extract the audio and then like generate the whole conversation like impersonating your voice. So now using AI, it's even easier to scam people. So again, all those points that I talked about becomes even more important now, because previously they had to work very hard. They had to use different kind of tools. They had to try to mask their voice or use some kind of different voice to impersonate a person. But using AI now, they can impersonate anyone with like very, very high degree of accuracy. So it's very, very uh, for me, it's a very scary thing to think about. But again, saying that, if you like follow all the good practices that I talked about, just being very, very careful about like whenever you receive some kind of information or you receive some kind of email or let's say a voice memo saying claiming to be someone and asking for some information, and if you are like suspicious about it, just a general good practice. So let's say a friend of yours will never be asking about your banking details out of the blue, right? So this kind of common sense helps a lot. And we, even with AI, there are like AI tools that can help you, mitigate this kind of dangers and scams that are emerging nowadays. But like I said, like just following all the good practices and using your common sense, and then also not to get intimidated, not to panic, and then asking for help when needed. Again, these good practices will also help you a lot, even when we are dealing with attempts that use AI. I hope that answers your question.
Thank you, Vishwas.
Thank you, Vishwas.
10 to 15 minutes. So just I think we have to jump into next session with Dr. Raju.
So
Akila.
Great.
I'll share the presentation. And
Thank you, Vishwas, for putting this.
Thank you everyone for your listening. Thank you.
Akila, you can share PowerPoint in your presentation and we'll try to the next one. So,
Yes. Is my screen visible now?
All good?
Yes.
Okay, thank you, Akila, for sharing the slides. And also thank you, Biswas, for your excellent presentation, in-depth presentation on the digital security. I think that was very informative. I really learned a great deal. This presentation, I think we prepared myself, Yakindra, and Manoj Karka, part of the global health team. We try to put some perspective, when we talk about empowering the CAL communities, the CAL community level of knowledge and the digital skill is very, very, very poor. When they are seen to be as a migrant, especially the older generation, and even the second generations, also who's coming to study in Australia, are not really understanding the digital landscape of Australian health system. And as you have seen and mentioned that Australia digital health system is come very new and is a recent thing, and there's very poor understanding of this system. So this slides is being prepared to give some perspective for them to understand what is digital health system and what is the role of digital skill and knowledge in understanding the digital health system to maximize their participation and benefit from that. So the next slide, please. Okay, I can do from here. So this, when we were interacting, when we held some of these workshop, Smart Health Global with the CAL community in southeastern suburb, we found the knowledge is very, very poor. They don't even understand what is the Australian health system is all about. So we put in some perspective to them, say to before you go to understand the digital skill or the health system, you have to understand how the Australian health system works. So if you look at it, I've just tried to give very basic information here, so that how Australia is governed by Medicare and how the government charges, the Medicare makes it free by charging the taxpayers, and how bulk, most of the GP doing the bulk billing early days. Nowadays it is not so. Most of the GPs are now charging for your visit. In early days, even the gap, Medicare used to cover up to 70% of their health expenses, but now it's reduced. It's not meeting with the CPI index, and now you can only get 50% of the coverage, so people are not aware of that. And people even don't understand that GP is the primary contact point, and the specialists are referred only by GP. Community pharmacy service, the newly introduced services government has introduced and doing a pilot study to bring the cost down. So you can go to the pharmacy and do your basic diagnostic. So you don't need to even go to GP. So hospital admission is done only in emergency. The waiting period for other services, if you don't have for any services to the Medicare, any operation takes about 2 to 3 years, and patient will have no choice of doctor and hospital. And recently, as you have seen, the NDIS is a big thing for the disability sector, and also the My Age Care for older generation people, how government has introduced the services and the system to take care of the aging population at home. So the NDIS and My Age Cares are the big part of the government Australian health system, considering the Australia is an aging population. So these very basic informations are not even the CAL community are not aware of it. They are just very blindly ignorant about these things, and they're always scared of going to a doctor like going to a police. So that's why we try to share this information to them in our earlier workshop. And when it comes to the primary healthcare provider, I think as it's 10% of our GDP is spent on the healthcare system in Australia, and it covers about 5% of the total employment in Australia. The doctors and general practitioners, community nurses, dentists, pharmacists are the part of the primary healthcare provider. And also the allied, there's a different discipline where allied health professionals include physiotherapists, dietitian, and speech pathologists. So this spectrum shows that how the Australians, so this is trying to give them CAL community a perspective how the health system works. And as I said before, NDIS and My Age Care is very important for the CAL communities, because in the recent time, in the last decade, we have seen not only the skilled migration is happening in Australia, all the skilled migrants are bringing their parents to to Australia as well to live together for various reasons. And there's a huge influx of migrations of the older generation to Australia. And this older generation doesn't really, they've never have had any computer in their life or the education in the background. So when they come to Australia, they have absolutely no knowledge of digital health care and understanding of the health system, NDIS or MyHealthcare. So we're trying to tell them that this government system works perfectly, and these are the services where you can access to them and get benefit of it. So this we went very basic to tell CAL community what the spectrum, health spectrum Australia. Most of the CAL community don't have private health insurance because it is very expensive. And they don't understand that if they don't take private health insurance, they are also being charged by government additional 1% surcharge. So it's kind of a catch-22 situation. People are forced to go to our private health system, and they don't know what the benefit of private health insurance versus Medicare. So we told them that if you have a private health insurance, you can go to hospital service anytime. You don't have a waiting period. You can have a choice of doctor, and you can access the system more quickly. So even these private and public health system perspectives, we very important for them to understand in Australia. And if you look at nowadays, when we are talking about Australian digital health system, it's been not very long. Government has completely digitized the health system as a top priority. Everything is in My Government, and the My Government is very complicated. It's not an easy to access and easy to log in, and the basic even informations are difficult for CAL communities, where understanding their language skill and their knowledge is so poor. For people like us, also we find difficulty understanding and going into accessing these services. So the My Government is not only about the health record; it's about any health claims or even your central link benefit or your tax and salaries. The government is trying to bring every health system integrated into other services as well. So this is very complicated, and the CAL communities will have absolutely no idea of what's happening here. So we try to go basic to them to say that, and we give them the training how to access online. So we also told them that government has this 23, 28 digital health planning system. Why this is so important is basically it is a digital economy. Everything is digitized. So national health, the government, when it's trying to come up with this digital health system, is mainly to make the system very efficient and user-friendly, patient focused, and at the cost-effective way. So for them to understand why the government is trying to go so fast and why they can't still access to them, so we have to tell them that it is important that they get equipped very quickly because government is shutting down all the conventional system, and this is very important to understand. So if the government framework is again designed on these policies are on the internet, that it's a framework, education, training, regulation. There are different components of digital health systems. They don't need to understand holistically everything of it to access the services, but it is good to tell them that how it comes about being in the digital, integrated into the digital health policies and things like that. So, and these are again, the government, the important thing is that government sees health agencies are as an equal partner to this. The government alone cannot do this. So government is looking for partners, digital health agencies and digital your health agency board. They've got a different advisory board. They have a different partners working in this thing. And the government, whole of the government coordination is depending on the database. So they're creating a database which is helping them to develop their roadmap plan. So this is a very integrated, sophisticated model that government is working on digital health system. We don't want to take this jargon into the CAL communities to understand everything of it, but we're just trying to give them perspective that how even like Smart Health Global could be an agency. We are working to empower the CAL community at the moment with the help of the government grant, but we see ourselves positioning into being in the future as a partner, as a registered partner to the government digital landscape. So we will be changing our role and position in the future and play more proactive role and in the digital health system with the government, bringing the CAL perspective because we do our organization is born out of the CAL community needs, and so we understand them better, and we would be one of the best partners working with government in the CAL community perspective. So again, as I mentioned, this thing, the government, the whole digital system is to connect the entire health system service and the providers, and it's person centered, and it has to be it's made very inclusive, and it's a data driven. So AI is being used by government to use the data to understand the trend and how the CAL communities, the knowledge gap, digital skill gap between the CAL communities, and then use and improve the services in future in a better, more coordinated, targeting specific group. So these are the system, and so for affordability and access. So as Vishwas mentioned that half of the CAL communities, they are low-income people. They have linguistic barrier. They are not very knowledgeable about it. So these are some of the access key priorities the government has to understand. Government does understand, but they don't get to understand. They said once the system is applied, it will slowly take over. I don't think it would because there's a lot of cultural sensitivity and linguistic barrier for our community to understand and affordability, and the government has to really bring those things into consideration. So impact of the digital, what happens if you are not connected digitally, what could be the impact on your overall health? We think we are doing this digital health system to improve their health system, but for various reasons as highlighted in this slide, if you are somehow excluded from the system, you are the worst sufferer you may be more suffering from the health benefit rather than getting health benefit. So it is not implied that once you connected means you have got access to every benefit. It's not. There's a huge gap between being connected and being having access to the real benefit. So again, and not everyone has the digital skill they need. Impacts of digital access I mentioned before. As Bishwas, you mentioned the top end of the digital security and the online connectivity and the gaps, and very important. That's at the high end. But at the low end, I think we have to really go to the basics and give this knowledge and mentoring. So the Smart Health Global has introduced also a program in our scheme to create champions, mentor from within the CAL communities, especially considering the linguistic barrier and the diversities, and also the hierarchy of our culture. The females are more marginalized than the men. So we are targeting very specifically a different age group in the female and also different cultures, and basically take this digital know-how and knowledge to them in their local languages, so that they own this and they understand it better. And we just don't give them one off. We just follow up with them. We still connected all through to make sure with the champions we created through this project, 100 and also in the future, they then go to the community. So it's kind of a chain reaction. So once we create these champions through Smart Health Global, they will then go to the community. So we don't need to go to the community. They will go to the community, and then how it spreads out, and then bring the CAL communities into the mainstream and understanding this digital landscape. So the Smart Health Global, as you can see, we are a global organization. Our offices is mostly focused in Nepal. We have very good system in place. We have access to a very remote and marginalized community. Currently, our focus is going from the remote in parental care and maternal care. But in Australia, we are a registered chapter. We've got this grant, and we are a global organization. So it's been a great pleasure working with the Australian system, digital health system, and the agencies, and we see ourselves positioning to play a major role. And we are very thankful to the Good Things grant for the foundation for the grants they have given us and to be partner in this initiative. It just might not, this slide, this presentation was basically is targeted for the Kal community. It doesn't really tell about the one Vishwas said that is the complete different end is the spectrum. We need both of these integrated into our approach. Going to the Kal community into the future, and that's why both these presentations are very important and brings a holistic, complete picture of the digital healthscape and access. So with that note, I'll conclude my presentation, and it's been a great pleasure and honor to be part of this great discussion forum today. Thank you.
Thank you, Dr. Raju. So now that we are coming to the end of a session, uh, I would like to ask Manoj, Dr. Ekendra, and Dr. Raju to give their closing remarks for this webinar.
Okay, thank you so much, Akila, for facilitation, and thank you so much, Vishwas and Dr. Raju, for very nice insights and regarding digital health safety, and also with some overviews of health system of Australia and how the CAL community is impacted with the both these new innovations and digital systems, and how we can facilitate as an organization to have a better health access in a safe way, digitally, online, and using these new innovative technologies. Uh, it's a good opportunity for us, everyone, to have a good discussion regarding on time regarding these innovations and health systems, and how we can make these health systems, government initiatives, in an inclusive way to deliver to the targeted population who are not included, or who are excluded, or who are a little bit marginalized or something. So maybe uh, going forward, we will be more focusing on providing more information or awareness to the those car community, even the people who are living in regionals or far from the uh, cities, or far from these access of these informations and services. So uh, it's a initiation. Maybe we will be a part of government of Australia to make to create awareness and helping government to reach those unreached population. Thank you so much. Good. Actually, we want to thanks to Good Think Foundation for the initiative and giving us opportunity to join them in the literating people with the digital technology. And we have a similar kind of mission and vision, then we can collaborate for a longer time. Thank you so much, and thank you everyone who is participated and who will be uh, streaming our online this videos and everything. Thank you so much. Anything do you want to
Oh yeah,
add?
everything is covered. Yeah, thank you very much for the physical participation as well as online participants. Yeah, both talks are very insightful. Definitely from Vishwas on this, how we can securely navigate the digital platform, and from Dr. Raju Adhikari, actually the situation of health systems in Australia, and then the level of awareness and knowledge of all communities about the health system. Definitely in the future, we will be expanding the scope of our activities, and we are very thankful to Good Things Foundation, and thank you to everyone joining today. Thank you.
So, thank you everyone. It was a pleasure to have all our panel members, and thank you, Bishwas, for the wonderful presentation, and Dr. Raju. I'm sure all of us had very good understanding of what we have to look into specifically in terms of digital security and what as Smart Health Global we are trying to do for the communities here. So, thank you for your time and engagement. Together, we can build a digitally literate and health empowered community to create accessible healthcare for everyone. Thank you.
Thank you. Have a nice day.
Thank you. Bye
Thank
bye.
you, everybody.
Have a
Thank you,
nice
everyone. Bye.